We're getting ready to do a Cosmelan peel. One of the things I talk as importance is I did my fellowship in New York, where half my patients were Black, Latin, or mixed ethnicities, and then I did my other fellowship in San Francisco, where over 70% of my patients were Asian. And it's really important when you are getting your specific skin type treated, you go to a dermatologist that understands different ethnicities and skin types. So here we have a patient with ethnic background. So our goal here today, one is his scars right now are going to peel and improve. Any textural regularities that he had from a previous laser will improve. He had a very good improvement in the first Cosmelan we had done, but now we're going to get more aggressive. So I'm super happy because it's going to make a big difference for him. And we all know how much scarring affects people, how they feel about themselves and everything. So we're doing a punch excision today where we take a little piece of the skin out where there's a scar, and we then suture it together so that we can close the scar up and get a better improvement in the scar over time. So that's closed. We now go on to the next. And what this does is takes those deep scars and makes them align so that we can more easily laser them to get a better improvement more quickly. And when people heal really well from this, you can do this over and over until you get all those scars. It's a process over time, but it can get a significant improvement. We are now doing the deep lasering around the temple and cheek area, because this is where our patient has the deepest scars. We're using what's called the Deep FX here, an ultra pulse laser that goes very deep in the skin. You can barely see the marks. You can see the little dots there. Those little dots are only 0.12 millimeters in diameter, which is why you can't see them, but they're going very deep into the tissue to remodel the deeper scars, which is why we're doing this specifically only to the areas of his deepest scars, which is really going to be his cheeks, a little bit on his jaw lines and his temple. You can see when you do this to the right level, there's pinpoint bleeding. So that means we're going into the papillary dermis and delivering the right amount of energy to get deep collagen production over time. This is not safe for all skin types. He prepared his skin using a peel to lighten the skin tone and calm it down. And mainly lighter skin tones can do this. And then we'll go on top with the more superficial laser. We're doing a laser resurfacing procedure for acne scars, actually a combination procedure of both deep and superficial laser, ablative fractional CO2, and some punch excisions to deeper scars around the eyes. We're now on the last phase where we're doing the laser, and our patient's doing really well. He does have some pain, but the nerve blocks and topicals have really helped decrease that amount of pain. Because we want a really good outcome for him, we pre-treated his skin with a peel to lighten the tone and exfoliate the skin, and allowing us to go deeper with the laser today, which is very close. It's about 80% fractional, meaning that it's very close to that ablative type of laser, because we really want to get him a good outcome. We've already done the deep laser over a lot of the acne scars around his temple, cheek area, where you know a lot of people get that severe acne when they're younger. So we're now finishing our laser resurfacing combination treatment. You could see where the deep laser was because it was all the pinpoint bleeding. Now we're putting growth factors and stem cells from his own blood, PRP, into the skin. And we're pushing it deeper into the skin, 1.5 to 2 millimeters in depth. And this is going to help him heal. PRP is drawn from your own blood. This is for post-procedural healing and to help the PRP and the skin get all the nutrients that it needs.